Hi everybody, we're going to be doing your emergency childbirth simulation. I'm just going to go ahead and run through the whole skill, so let's get started. Standard precautions, scene safe. I'm going to go ahead and approach my mother and ask her a few questions. I'm going to ask her questions like, how far along are you in your pregnancy? How far apart are your contractions? How many pregnancies have you had and how many births have you had? So I would note the para and gravida. At this point, I'm going to go ahead and ask the mother if I can take a look down there. And I'm going to go ahead and lift up her dress. So I do see that delivery is imminent because there's crowning of the baby's head. So I'm going to go ahead and prepare my OB kit. I'm going to go ahead and take my wipes. I'm going to take one wipe from anterior to posterior on one side, the other wipe anterior, posterior down, and then one down the middle. Then I'm going to go ahead and put on my sterile gloves, and then create a sterile field for birth. So I'm going to go ahead and fold this, and I'm going to ask the mom to lift her hips up so I can place this, on the bottom, and then one on this side. On the other side. Alright, and then now I'm going to go ahead and give birth to the baby. So I'm going to make sure that there's always a guard or my hand placed on the perineum so her perineum doesn't tear. So now I'm going to go ahead and have her push and have the press down gently on the baby and then press up and then keep going on this motion, making sure not to pull until the baby's shoulders are out. So now the baby is out. And then I'm going to make sure that the umbilical cord wasn't wrapped around his neck. I'm going to go ahead and wipe down the baby. And then suction the baby's mouth first, and then nose. I'm then going to go ahead and take the baby's APGAR score, so making sure that the baby's always leveled with the mother's hips. I'm going to go ahead and take the APGAR score at 1 minute, and then wrap the baby in a blanket. Little beanie. And now I'm going to go ahead and cut the umbilical cord. So the first clamp I'm going to place about 6 inches away from the baby. I'm going to place one right there. And then the second clamp is going to be 3 inches away from the first clamp. So it's going to be about right there. So I'm going to go ahead and clamp that. So my clamps are right here. I'm going to wait for the umbilical cord to stop pulsing and then cut. So this baby is... So after I cut the umbilical cord, I'm going to go ahead and reassess the APGAR score at 5 minutes and then place the baby to the mother's breast. I'm then going to wait for the mother to birth the placenta. And as soon as the placenta comes out, I'll be sure to place the placenta in a bag. And to be sure to have this transported with the baby and the mother. I'm now going to attach a bracelet to the baby and then one in the mom for identification. And then I'm going to make sure the baby is to the mom's breast and assess for any bleeding. If she's bleeding, I'm going to keep the baby to the mom's chest and then massage her fundus to control the bleeding. Then I'm going to go ahead and place a napkin on there to control her bleeding and be sure to transport the baby and the mom to the same hospital. That's it.